Just because you wind up with a health problem doesn't mean life's over. It means that you find a person that can help you. My name is Mickey.
My name is Carla. I'm Mickey's wife and his caregiver, and he was diagnosed with uHCC last year.
One night I went to bed, woke up several hours later, terrific stomach cramps, pains, and they recommended that I have a port put in so that they could check my stomach.
That whole week was nothing but oncologist, port placement, this scan, that scan. It was scary at first, just not knowing what treatment options we would have.
It leaves you with torn, mixed up feelings because you don't know, am I going to get better? Am I going to get worse? But to be very honest with you, once they diagnosed my problem, started me on treatments, it gave you a different mindset because you realize that there is hope that things will get better.
When the doctor prescribed the IMFINZI and IMJUDO for Mickey, I had a lot of questions.
IMFINZI is a prescription medicine used in combination with IMJUDO to treat adults with a type of liver cancer that cannot be removed by surgery, unresectable hepatocellular carcinoma, or uHCC.
I went to IMFINZI.com and I got some really good education resources off of that website too.
I feel like the doctor I had was very upfront. He explained to me that I might have some after effects.
I would just say that after his treatments, he did experience being tired.
Carla is very supportive. She goes with me to the doctor and follow her up as a caregiver that I follow their instructions.
My advice for someone who is a caregiver to a patient is to remember you have to take care of yourself.
I look forward to every day now. Keep a positive attitude. If you need help, don't be afraid to ask for it.
Important safety information. What is the most important information I should know about IMFINZI and IMJUDO? IMFINZI and IMJUDO are medicines that may treat certain cancers by working with your immune system. IMFINZI and IMJUDO can cause your immune system to attack normal organs and tissues in any area of your body and can affect the way they work. These problems can sometimes become severe or life-threatening and can lead to death. You can have more than one of these problems at the same time. These problems may happen anytime during treatment or even after your treatment has ended. Call or see your healthcare provider right away if you develop any new or worsening signs or symptoms, including lung problems, cough, shortness of breath, and chest pain, intestinal problems, diarrhea, loose stools, or more frequent bowel movements than usual, stools that are black, tarry, sticky, or have blood or mucus, and severe stomach area, abdomen pain or tenderness, liver problems, yellowing of your skin or the whites of your eyes, severe nausea or vomiting, pain on the right side of your stomach area, abdomen, dark urine, tea-colored, and bleeding or bruising more easily than normal. Hormone gland problems, headaches that will not go away or unusual headaches, eye sensitivity to light, eye problems, rapid heartbeat, increased sweating, extreme tiredness, weight gain or weight loss, feeling more hungry or thirsty than usual, urinating more often than usual, hair loss, feeling cold, constipation, your voice gets deeper, dizziness or fainting, and changes in mood or behavior, such as decreased sex drive, irritability, or forgetfulness. Kidney problems, decrease in your amount of urine, blood in your urine, swelling of your ankles, and loss of appetite. Skin problems, rash, itching, skin blistering or peeling, painful sores or ulcers in mouth or nose, throat, or genital area, fever or flu-like symptoms, and swollen lymph nodes. Pancreas problems, pain in your upper stomach area, abdomen, severe nausea or vomiting, and loss of appetite. Problems can also happen in other organs and tissues. These are not all of the signs and symptoms of immune system problems that can happen with IMFINZI and IMJUDO. Call or see your healthcare provider right away for any new or worsening signs or symptoms, which may include chest pain, irregular heartbeats, shortness of breath or swelling of ankles, confusion, sleepiness, memory problems, changes in mood or behavior, stiff neck, balance problems, tingling, numbness, or weakness of the arms or legs, double vision, blurry vision, sensitivity to light, eye pain, changes in eyesight, persistent or severe muscle pain or weakness, muscle cramps, joint pain, joint stiffness or swelling, and low red blood cells and bruising. Infusion reactions that can sometimes be severe or life-threatening. Signs and symptoms of infusion reactions may include chills or shaking, itching or rash, flushing, shortness of breath or wheezing, dizziness, feel like passing out, fever, and back or neck pain. Complications including graft versus host disease, GVHD, in people who have received a bone marrow stem cell transplant that uses donor stem cells allogenic. These complications can be serious and can lead to death. These complications may happen if you underwent transplantation either before or after being treated with IMFINZI. Your healthcare provider will monitor you for these complications. Getting medical treatment right away may help keep these problems from becoming more serious. Your healthcare provider will check you for these problems during your treatment with IMFINZI and IMJUDO. Your healthcare provider may treat you with corticosteroid or hormone replacement medicines. Your healthcare provider may also need to delay or completely stop treatment with IMFINZI and IMJUDO if you have severe side effects. Before you receive IMFINZI and IMJUDO, tell your healthcare provider about all of your medical conditions, including if you have immune system problems such as Crohn's disease, ulcerative colitis, or lupus, have received an organ transplant, have received or plan to receive a stem cell transplant that uses donor stem cells, allogenic, have received radiation treatment to your chest area, have a condition that affects your nervous system, such as myasthenia gravis or Guillain-Barré syndrome, are pregnant or plan to become pregnant. IMFINZI and IMJUDO can harm your unborn baby. Females who are able to become pregnant, your healthcare provider will give you a pregnancy test before you start treatment with IMFINZI and IMJUDO. You should use an effective method of birth control during your treatment and for 3 months after the last dose of IMFINZI and IMJUDO. Talk to your healthcare provider about birth control methods that you can use during this time. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment with IMFINZI and IMJUDO. Are breastfeeding or plan to breastfeed? It is not known if IMFINZI and IMJUDO pass into your breast milk. Do not breastfeed during treatment and for 3 months after the last dose of IMFINZI and IMJUDO. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of IMFINZI and IMJUDO? IMFINZI and IMJUDO can cause serious side effects, see above. The most common side effects of IMFINZI and IMJUDO in people with uHCC include rash, diarrhea, feeling tired, itchiness, muscle or bone pain, and stomach abdominal pain. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of IMFINZI and IMJUDO. Ask your healthcare provider or pharmacist for more information. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of AstraZeneca prescription drugs by calling 1-800-236-9933. If you prefer to report these to the FDA, either visit www.fda.gov/medwatch or call 1-800-FDA-1088. What are IMFINZI and IMJUDO? IMFINZI is a prescription medicine used in combination with IMJUDO to treat adults with a type of liver cancer that cannot be removed by surgery, unresectable hepatocellular carcinoma, or uHCC. It is not known if IMFINZI and IMJUDO are safe and effective in children. Please see full prescribing information, including patient information, medication guide, for IMFINZI and IMJUDO at imfinzi.com.